Neurosurgery is a dream of many medical students, inspired by figures like Dr. Ben Carson. Today, we have with me here a noble and a respectable doctor in the Tamale Teaching Hospital. He's going to share a work in the neurosurgery field. So, welcome, doctor.
Thank you very much.
Please, can you tell us about yourself and how you got here?
Good afternoon to you all. I am Dr. Malcolm Mambouraa Dery. I'm currently a neurosurgery resident with the Ghana College of Physicians and Surgeons. Currently, I'm in the Tamale Teaching Hospital undergoing part of my training.
Can you discuss with us the step-to-step how you got to be a resident in neurosurgery?
Okay. First of all, it all started when I entered medical school at the University of Development Studies in Tamale. I went through 7 years of training to become a medical doctor. So in 2017, by God's grace, I completed medical school and then started the mandatory period of housemanship as stipulated by law in Ghana. So I went through housemanship for 2 years and then completed and became a medical officer. Having become a medical officer, I had the option of going through any specialty I would have loved to. But in the process of doing housemanship, and especially when I did surgery and neurosurgery, I've always had a soft spot for the brain and for the spinal cord, especially about how it is structured, how it is organized anatomically. So I've always wanted to explore it more. So during housemanship and then during the period of learning, I noticed that really neurosurgery is one area that I should consider seriously. And when I came for housemanship, I really enjoyed everything I went through in neurosurgery in terms of the knowledge I acquired, the skills, and then also participating in taking very important decisions. So when I had the opportunity to choose neurosurgery, I didn't even think twice. I just knew that from the beginning, this is the field that I want to be, to contribute my quota towards the development of neurosurgical practice in Ghana and in the world at large.
Oh wow, just like that, he knew his calling. Okay, so you talk about having soft spots for the anatomical nerves and all those things. But what actually inspired you to be a neurosurgeon? Was there a spark?
Yes, so neurosurgery is basically the brain and the spinal cord. But something struck me about neurosurgery, how the brain is organized. Very, very minute structures that have been compacted to make this very nice surface of the brain. How very nice fibers come together to form one giant tube that connects the brain and the rest of the body. And how even as at now, some functionings of the brain and the spinal cord are not fully or 100% understood. So I was quite curious about that. And I was also, I had the privilege of watching some medical series in the course of my training as a medical student. And whenever it came to new surgical conditions, I was amazed about how the doctors usually at the emergency and even on the wards, how they intervene quickly. And the patient who is at the point of death, all of a sudden, after surgery, is back to life. And sometimes the joy you see in the relatives, it was so marvelous before me. And then I really decided that this is something I should consider. So it was during the period of housemanship, I really consolidated that passion. When I did housemanship, as I mentioned, I saw how patients come in a very bad state in terms of having suffered a traumatic brain injury, and then the intervention that are put in place, and then the results that we get, especially those who come with acute hemorrhage into the brain. Shortly after surgery, they come out very successful and they go home. So I began to say, no, this actually is the place I want to be. So it's the period of training as a medical student, and then also some of the series I watched, and then read about some neurosurgeons, and I really got attracted to the field. And then by God's grace, here I am, and hopefully one day I'll also be a neurosurgeon.
Oh, may I say you're already a neurosurgeon because of the wonderful surgeries you did during our rotation. You're really good. So for your information, he's adventurous and want to know more. So you also have that passion or that ability to be hungry for knowledge. Thank you. So for those who are unfamiliar with neurosurgery, what is it and what does it encompass? Maybe what the neurosurgeon is expected to do.
Okay. So neurosurgery, our field has to do with the nervous system. The nervous system is the main system that controls every part of the body. In fact, every structure with its function can be traced to the brain and then the spinal cord. So basically, these two structures are what control the rest of the human body and functioning. And so, if you take the brain is one of the areas that we work on. So, issues that have to do with the brain. Then also we have the spinal cord. The spinal cord is to put it in plain language, it is like a long tube that connects the brain to the rest of the body, and it is through the spinal cord that the body transmits all these impulses for the function of the various systems. And it's the neurosurgeon that plays a role in the management of these cases. So we specialize in treating conditions of the brain and the spinal cord, which are, as I mentioned, are the two main organs that control the functions of almost all other structures in the body.
Oh, okay. So to our future neurosurgeons out there, you have a very important work to do. So you gotta learn hard. Okay, so in your point of view, what do you think makes neurosurgery stands out or unique compared to other medical specialties?
Neurosurgery is very, very unique. As I mentioned, first of all, because every structure, every organ in the body needs to function, you need to have a certain organ or a certain structure that controls all these functions. And lo and behold, these structures that control these functions are the brain and the spinal cord. Now, the interesting thing about the brain and the spinal cord is that these structures, in terms of their organization, is highly, highly specialized. You will see they are very minute structures that have come together to form this nice structure called the brain, and then the same kind of arrangement for the spinal cord. And so, if you look at our side as neurosurgeons or neurosurgery trainees, the unique thing about us, first of all, has to do with the fact that whatever we do, it has a direct impact on the individual. And so, in working on the brain or working on the spinal cord, there's little room for error, because one little error and then the patient is damaged, sometimes permanently, for the rest of his or her life. And so that is quite unique about neurosurgery, and the fact that it is still an area where, unlike some other specialties where you can easily do certain transplant, as stands now, in terms of transplanting the brain, is not one that has been successful, or transplanting a spinal cord is not one that has been successful. And so it is still a very unique area in the fact that it's still evolving, and then there are still some gray areas within the specialties. But of course, as knowledge is increasing and then more technology, with time it will be able to expand, and hopefully some of these other things like transplant could be done in future. But as it stands now, the unique thing about neurosurgery is the fact that we operate on the structures that are responsible for the direct control of almost all other organs and structures in the body.
Okay, there you have it. So, to the guy out there who is having headache or experiencing any neurological symptoms and you're delaying in your house, please, you can't transplant your brain unless maybe there is somebody in Suwon who is trying to do a brain monocloning or something so that you can get a different brain. But that one, I think you will be a different person, because if your brain is changed, I'm not sure you're going to be the same person. And to Dr. Malcolm, I want to be a neurosurgeon. He wants to be a neurosurgeon. The guy who was born yesterday wants to be a neurosurgeon. So if you can outline the paths for somebody to be a neurosurgeon, maybe right from birth or maybe from medical school to neurosurgeon, if you can add the requirements to be a neurosurgeon, especially in Ghana, to it, we'll be very happy.
Okay. So neurosurgery, to be a neurosurgery resident and eventually be a neurosurgeon, it is a very long and tortuous route. First of all, having gone through basic education and then senior high school education, one has to find his or her way into the medical school. So after going through medical school training, to practice in Ghana, mandatorily by law, you have to go through housemanship. Housemanship is a period where there's intense training and acquisition of skills. And by law, you have to go through 2 years of housemanship training. Having finished housemanship training, then you can begin to think of going to neurosurgery. In the past, you have to finish housemanship training, work as a medical officer for a couple of years, 1 year or 2 years, depending on whether you are at a big facility or you are at a less privileged facility. However, the Ghana College of Physicians and Surgeons in recent years have made significant modifications to this. And so during the period of housemanship, one actually has the option of writing what we call primaries. Primaries are exams that are written to gain entry into any of the postgraduate training with the Ghana College of Physicians and Surgeons or the West African College of Physicians and Surgeons. I'll focus more on the Ghana College of Physicians and Surgeons. So during the period of housemanship, one can actually prepare adequately for the primaries in neurosurgery and sit for the exams. If one is successful in the exams, after the period of housemanship, one can apply to start the training in neurosurgery, which is a street fellowship program for 6 years. So for the primaries, what does it entail? The primaries basically is to test your knowledge about basic sciences. So it has to do with neuroanatomy, neurophysiology, neuropathology, neuroembryology, and then neuroradiology. These are the 5 areas that one will have to study to write the primary. So during the period of housemanship, for any of you out there who is interested in doing neurosurgery, you will have to sacrifice and make time to read all these 5 other areas that I've mentioned earlier. There's also the option of entering neurosurgery if one is already a specialist, let's say a specialist in general surgery. One can still enter neurosurgery either with the Ghana College of Physicians and Surgeons or the West African College of Surgeons. However, through that route, because of the start of the street fellowship program in neurosurgery, it's for a limited number of years. So for someone who's a general surgeon who wants to enter neurosurgery, there's a limitation to it. After a couple of years, that whole program will end and everything will be straightforward as in a straight 6-year fellowship training. So for now, these are the requirements that one has to go through to start neurosurgery and complete neurosurgery. After the 6 years, one will go through exams, and if you are successful, you'll be duly certified as a neurosurgeon in Ghana.
Oh, okay. So thank you. So if I heard you right, you are saying currently there are 2 routes. So you can either be a general surgeon or you can just go straight. But were you saying they are trying to remove that second part from it so that it just make it 6?
Yes. So since the direct fellowship training for neurosurgery started last academic year, started in November last year. And so with the advent of this particular system, the aim of the faculty, and for that matter, the college, is to eventually ensure that neurosurgery, the training is straightforward for 6 years. And so, but the college also recognizes that there are some colleagues of ours, our senior colleagues, who might be doing general surgery with the intention of doing neurosurgery. So the college has made provision for a certain number of years that will allow all those who have started general surgery or are about finishing general surgery and had the intentions of doing neurosurgery, they will have the opportunity to get into neurosurgery through the old route. However, after that number of years, every other person will have to go through the street fellowship training. So there's a limitation for that, and it allows for all those who are already in the program of general surgery to complete and enter neurosurgery before it eventually folds up.
Oh, okay. Thank you. So what attitude or qualities do you think are essential to succeed in this demanding field?
So for neurosurgery, as I mentioned, it is an area that requires a lot of sacrifice. I know in all other specialties there's sacrifice that has to be done, but neurosurgery is also quite unique because the training is not an easy training. The training is very intensive because, as I mentioned, there is room for very, very minimal errors. There is no room for errors at all because you are dealing with somebody's brain, you are dealing with somebody's spinal cord. One wrong move, and then that can be the end of somebody's life. And for that matter, the multiple effects that will happen on the person's family and society. And so it requires a lot of dedication. One has to be committed. One has to be ready to sacrifice a lot of other things to do neurosurgery because virtually Most of our life, we spend it in the hospital, in theater, at the clinic, on the wards, in order to acquire all the necessary skills that will be able to help us take care of patients. And so you have to sacrifice some other pleasures that ordinarily you would have loved to enjoy. Of course, it also has to do with balancing your life, but it requires a lot of dedication, a lot of commitment, and we have to be very meticulous in the practice of our specialty. And you need a lot of concentration, you need a lot of financial support, and of course, you need emotional support, social support, and then, of course, by the support of the Almighty God. You need all that, and eventually, you'll be a good neurosurgery resident and a good neurosurgeon.
Oh, okay, wow. So now that we are now neurosurgeons, let's come to the neurosurgery proper. So what is a typical day like as a neurosurgeon?
So a typical day, let's say on a typical day, we have various activities that we do for each day. But on most of the days, the activities are the same. So I, for instance, at the Tamale Teaching Hospital, on a typical day, I have three main areas that will have to have an idea what is happening to our patients. One is at the accident and emergency. I'm practicing at an area or studying at an area where road traffic accidents is one of the major causes of morbidity and mortality. So on a typical day, I go through the accident and emergency to see all the cases that have come, the new cases that have arrived over the night and into the morning, the cases that are already there, whom we are managing, and we will have to have a plan for the patients. Also, we have to go to theater, so we prepare our patients adequately and take them to theater for various surgical interventions. On some specific days, we have neurosurgery clinic, and so on the clinic day, we see all the patients that come with various conditions, and then because currently the number of neurosurgeons and even the residents are few, we tend to get a huge volume of cases, and so typically on a day of clinic, we spend a lot of time at the clinic. Usually when we start in the morning, sometimes around 4, 5, or even 6 p.m. we are still at the clinic. So that's how a day at the neurosurgery clinic looks like. And of course, we also have time for our patients on the ward. And as a student, there's always academic activity. So on every single day, there's an academic presentation that is done in the morning so that we abreast ourselves with the conditions that are present on the ward in terms of the patients, and also the plan for those who are still at the accident and emergency, and also various topics that have been given to us by our consultants and our tutors so that we can have a holistic approach to taking care of our patients. So on a typical day, when I come to work at 7:30, I end up going home around 10, 11, sometimes 12 a.m. That is a typical day in neurosurgery for me.
Wow, that's a whole lot of commitment. So what experience in your journey as a surgeon will you never forget?
So I have had the opportunity as a young practicing neurosurgery resident or as a doctor to experience quite a number of interesting um, events in my life as a doctor. However, with regards to neurosurgery, the events that I don't forget when a patient comes in having been involved in a road traffic accident and the patient is at the point of death or near death. You see the despair in the sight of the relatives, how they appear depressed and demoralized. The relatives don't really know what is going to happen, especially with regards to issues of the brain and sometimes some of the myths that they might have heard in society. So on a typical day like that, when I see how we are able to quickly see the patient, do imaging, and then diagnose that the patient has had an acute epidural hematoma. The patient is quickly sent to theater, and immediately we take out the hematoma. After a couple of hours, you see the patient recovering, and then after a couple of days, the patient comes back, is talking, and is virtually back to life. And you see the joy, the excitement in the eyes of the patient. That gives me a lot of joy, a lot of pleasure. Again, our patient comes in with spinal cord injury, especially of the cervical spine. The patient can barely move the hands and legs, and quickly we intervene, go in and decompress the spinal cord and the neural elements, and then the person starts recovery through physiotherapy. And after a couple of months, the person is back working, and that gives a lot of joy and a lot of satisfaction. That is what gives me joy.
Oh wow. So with this number of years, look at it from medical school 6 years, residency, then straight 6 years again. There are a lot of years. So have you ever regretted choosing neurosurgery as a specialty? Or maybe you could have gone to one of these specialties required maybe like 2 years, 4 years to finish. Have you ever regretted?
So for me, I have always loved neurosurgery, and I'm somebody who likes challenge. I usually like areas that is perceived to be a difficult area, or an area that people think that the area is one that people should not even consider, or people should not. The tax there is too much. This is the challenge that I like, and in everything I try to do, I try to venture into things that is challenging, and I believe that by dedication, by commitment, and by the support of family, friends, my teachers, my tutors, and of course, by the grace of God, I believe that I'll be able to excel. And so for me, neurosurgery, I've never regretted doing neurosurgery. If I have an opportunity to choose another specialty, I'll still choose neurosurgery, mainly because of the drive that pushes me. As I mentioned, I am one who usually likes challenges, and even during my period of housemanship, I usually look for cases that are challenging, and those areas I try to do my best, and that gives me a lot of joy at the end of the day. And so I'll always choose neurosurgery. I've not regretted, not even a single day, and I'll always choose neurosurgery.